the route of mobility or transfer of that person. From the infectious disease prevention countermeasure perspective, that kind of information is necessary. So we try to protect privacy information, and on the age, we don't say 54. We just disclose up to the level of that person was in the 50s. But we do disclose information that is useful to countermeasures against infectious diseases. It would be case by case. The level of detail to be disclosed would be case by case, but we try to strike a balance which is rather sensitive and complicated. So to prevent discrimination, are you taking any measures? Because that person is not to be blamed for becoming infected. It's viral. People don't get infected because they did something bad. So discrimination should not be permitted. So do you have any measures to prevent discrimination? Your point is very right. And we are concerned about possible discrimination. But there is no one policy that would serve as a panacea to prevent all forms of discrimination. What can MHLW do? We can try to prevent misinformation from spreading, to be accurate in the information that is made public in terms of the spread of viral infection. So we are making use of website and using these opportunities such as press conferences to disseminate the correct information. But can we resolve discrimination? We are thinking, but we haven't come up with the right answer yet.
Reynolds?
Bloomberg News, no, Reynolds.
Reynolds of Bloomberg News. Intentionally, there was one case of intentionally transmitting the disease to other person. Do you have any effective measures to respond to those cases?
Such a case, yes, we are aware of such a case. However, at least as far as MHLW-related laws are concerned, I don't think we have laws under which we are able to respond to such a case. The criminal-related laws may be employed to address such a case, and also consideration is already underway in our understanding.
I'm Thomas Hahn from Süddeutsche Zeitung. That's a German newspaper. I have two questions. The first one is a little bit hypothetical. If you would change your approach to testing, what would you think would change in order to having, I mean, definitely you would have more infected cases, but how much more? Is there a slight idea? And if this number is high, what would it mean for the actual situation right now? And the second question is, what is actually the perspective? So how long does it take until things go back to normal, when people can, well, they won't have their Hanami this year, but anyway, so museums are open again, and also with respect to the Olympic Games.
Yes, exactly. That's what being evaluated by experts. So as of now, I can't say anything about that. With regard to testing, I would like to give a supplementary explanation. Going forward, the capacity of testing will be increased, as I explained earlier. And that forecast prediction is such that the testing is now covered by national insurance system, health insurance system, and private companies are now entering into the scene in conducting testing. As of now, the number of patients is hovering at a limited level. Therefore, going forward, we are going to maintain the current system. However, in the future, when we have more patients, what kind of system would be necessary? I think that is something to be discussed in a separate manner, because this is a hypothetical question. So it is difficult for me to judge to what extent I can say about such a hypothetical question. For example, in any medical institutions, perhaps all the testing should be outsourced to private companies because there will be many patients through community transmission, and I think there is no change in terms of the possibility of in-hospital infection because of the too much spread of the infectious diseases. In that case, any hospitals can be used for PCR testing. That is one scenario. Another point is technical issue. The medical institutions may use simplified testing kits possibly in the future. Therefore, if we have such a simplified medical testing kits, we will have to consider what would be the most appropriate, effective medical system. I have supplementary remarks regarding Mr. Han's question. Let me add that MHLW, as of the 6th of March, gave administrative communication, a notice to each prefecture. We gave a notice to the prefectures. This is under the one hypothesis. We are asking them to do some things under some hypothesis. That is to say, the number of patients is likely to increase in the future. Therefore, please carry out calculation on 3 points. First point is the outpatients. What would be the necessary number for treating outpatients? And second point, the number of beds needed to hospitalize infected people. And thirdly, of the hospitalized patients for patients with severe symptoms, what would be the necessary number of ICU beds? This is quite a complicated method of calculation, although this is in public domain, so I can give you the details if necessary. But at the time of peak, in each prefecture, epidemiological relationship cannot be captured because of the spread of infectious diseases, and the peak may occur 3 months after the situation where the epidemiological linkage cannot be detected. So the peak may occur 3 months after the detection of no epidemiological linkage. So in this notice, based on certain the calculation methods, the number of outpatients, the inpatient beds needed, and also ICU beds needed. So these three numbers are to be calculated, but it doesn't mean that this situation will be entailed or eventuated. So if we do not do anything, in a worst-case scenario, we would face a dire situation. Therefore, please make a calculation for the worst-case scenario. That is a request we made to the prefectures. And 6th of March simulation, let me give you more information. Earlier, the 3 months, that is only a worst case scenario. What we are doing in terms of cluster countermeasures, by implementing such measures as we do now, the peak, which is likely to arrive after 3 months following a certain situation. However, we can delay the peak, we can reduce the peak, and this is also included in the communication we gave to prefectures. That is why the prefectures are making efforts to respond to clusters. Thank you very much for giving me another opportunity. So, following your line of thought, currently anybody can be hospitalized. However, from when and under what plan are you going to tell those with mild symptoms to stay at home? When are you going to do that? And in that case, self-isolation or staying at home is not fully abided by. And in Japan, still you are continuing to make only a request. Are you going to strengthen that measure to make it enforceable? Frankly speaking, the timing for which we change the policy has not been decided because the situation differs from one region to another. MHLW, vis-a-vis each prefecture, localities, we said that if local hospitals are not able to take in further inpatients, at that time, please tell us, and we discuss. That's what we said to the prefectures. Under the current situation, we have designated infectious disease hospitals. When we have such an infectious disease emergence, the number of beds of hospitals in responding initially, in some prefectures, such beds are being filled almost. On the other hand, other institutions' beds are still available. So MHLW is providing assistance to control beds. Now, bed control, as long as we are able to carry out bed controls, you say perhaps hospitalizing patients would be more effective in containing the spread. Therefore, infectious disease spread in localities also closely related to the need for requesting people to stay home. If there is a saturation of hospital beds, in that case, asking people to stay at home, although some may not follow such a request, that would go a long way in such a locality. So shifting our gear would be based on the situation in prevailing situation in each locality. Swift-san.
Thank you once again, Rocky Swift at Reuters. So, to restate a question, when I go home every night to the Tamachi area, I see bars and restaurants full of people. And you can imagine that around almost every station in Tokyo. Now that is in stark contrast to measures being taken in San Francisco, in New York, in Rome. Even Ireland has ordered all of its pubs to be closed, which if you know anything about Irish culture, that's a big deal. So I guess against all this, why, and you've answered this question a few times in different ways, but why are you so confident that you have this situation under control in Japan, that you're not elevating the measures to what we're seeing in other countries? Thank you very much.
Well, we are closely watch the situation. We have to watch the situation. For example, page 3 that I showed you today in my presentation, on the left-hand side, you see numbers in each day. On the right-hand side, the cases in each week. So this is weekly-based data in terms of the confirmed cases. So definitely, the confirmed cases in each week is rising. In some European countries, the pace of increase is on a daily basis. However, in the case of Japan, the increase is quite slow because such increase is seen on a weekly basis. So at least by until the last week, we are seeing an increase of confirmed cases on a weekly basis. So we have to be very careful. We have to carefully watch the situation. That is why we are conducting investigation, collecting data, and based on which we have consultation with experts to make a decision or judgment. So it isn't that we are complacent or we are optimistic.
Ms. Rich, please.
To follow up on that question from Mr. Swift, isn't part of the reason why we're seeing more dramatic increases in other countries because they're testing more than Japan? And my other question is, based on a number of things you've said this evening, including the fact that there's the possibility of outbreaks 3 months after originally seeing cases. I didn't quite understand what the 3-month lag was, but based on that and also the possibility of increasing border measures against people coming into the country, I'm having a hard time seeing how it will be possible to hold the Olympics. And I wondered if you could explain how the conditions are going to change dramatically enough in Japan to make the Olympics possible?
Because of that situation, we are trying to mobilize all available measures to implement all the measures and to do the best. This rising curve of infection must be halted as quickly as possible to control the outbreak. And in order to realize that as quickly as possible, we are making all our efforts. And also, on the question of why 3 months, we're not saying that for the totality of Japan, the peak will arrive 3 months after a certain timing. The formula that I introduced would apply to units that are smaller than one prefecture, and that would be the formula that can be used in a smaller area space than one prefecture. For example, in Hokkaido, this 3 months clock has begun to tick once, but due to public health measures, that clock has been suspended because of the effectiveness of the public health measure. So it's not just simply 3 months after a certain timing, and please don't be overly preoccupied by that number 3 months.
If not, I'd like to conclude the press conference today. Thank you once again for gathering in the evening and joining us. Thank you.